You're in the third row at a wedding. The vows are happening, the room is silent, and you feel it start. That tickle at the back of your nose, the countdown you cannot stop. So you do what everyone does. You pinch your nose, you clamp your mouth shut, and you hold it in. It works. A small muffled squeak, and you are safe. Except that sneeze did not disappear. It went somewhere, and 2 men in Britain found out exactly where. One of them spent 2 weeks in hospital being fed through a tube. The other tore a hole in his windpipe while sitting behind the wheel of his car, and became the first person in recorded medical history to manage it. Their cases sit 11 months apart in the same journal, and together they explain what a stifled sneeze does to the inside of your neck. One thing before we start. I want to know the worst place you have ever had to hold one in. A wedding, an exam, an interview, a hospital ward? Put it in the comments. I read them, and the answers on this channel are usually better than the video. There is a number running through this whole story, and it is the reason both men ended up on a hospital scan. Most people have never heard it. Once you have, holding one in will feel different for the rest of your life. The number only makes sense once you stop thinking about a sneeze as air. Start with the thing almost everyone gets wrong, because it points in exactly the wrong direction. Ask anyone how fast a sneeze travels, and you will hear 100 miles an hour. That figure has been repeated for decades, and it does not survive measurement. When Lydia Buruiba's lab at MIT filmed real sneezes with high-speed cameras, the air leaving the mouth came out at around 4.5 meters per second, roughly 10 miles an hour. Methods that track individual droplets rather than the whole cloud give higher figures, somewhere in the 30s. The spread between them is the honest answer. Nobody has landed on one clean number because several things are moving at once, and they move at different speeds. None of that matters for what happens inside your throat. Speed describes what a sneeze does after it leaves you. The damage happens in the half-second before, while everything is still sealed in. To see it, you have to look at what your body has already done by the time your hand reaches your face. A sneeze does not begin at your nose. It begins in your brainstem. Your nasal lining is packed with nerve endings that report irritation. Pollen, dust, pepper, smoke, and for roughly a quarter of the population, a sudden bright light, which is an inherited trait that runs in families. Those signals reach a cluster of neurons in the brainstem that neurologists call the sneeze center, and that cluster does not ask permission. It runs a fixed sequence and takes your breathing muscles off you for about a second. First you inhale, deep. Then the epiglottis, a flap of cartilage at the top of your airway, snaps shut. Your vocal cords tighten behind it. The air is now trapped, and your body is deliberately holding it there. Then your chest, throat, and abdominal muscles contract at once, hard, against that closed seal. Pressure builds, with nowhere to go. The release comes when the seal opens, and everything leaves through your nose and mouth in one burst. Notice what that means for a stifled sneeze. By the time your hand arrives, the sequence has already fired. Your fingers never stop the sneeze. They seal the exit of a system that is already loaded. Which brings us to the number. Take a garden hose with the tap fully on. The water is coming. That part is settled. The only thing you control is the end of it. Leave it open and the water leaves. Put your thumb over it and the water does not stop. It gets faster, thinner, and it finds whatever gap you left it. Your airway follows the same principle, with one difference. This hose is made of tissue, and tissue has a breaking point. Here is the number. When doctors in Dundee worked out what had happened to their patient, they calculated that pinching the nose and closing the mouth drives pressure inside the trachea to more than 20 times what a venting sneeze produces. A sneeze that leaves freely keeps airway pressure at around 1 kilopascal. Seal both exits, and you are in a range your windpipe was never built to hold. 20 times. Stifling a sneeze multiplies the exact thing it was supposed to stop. And that pressure needs a way out. Your nose is pinched, your mouth is shut, so it takes the routes you never thought to close. There are 3 of them, and the first one is the reason your ears pop on a plane. Behind your nose, Two narrow tubes run up toward your middle ears. They are called the eustachian tubes, and their job is to equalize pressure on either side of the eardrum. On a normal day, they handle a yawn, or a descent into Heathrow. During a stifled sneeze, they become the shortest way out for a blast that just got 20 times stronger. Air driven up those tubes causes pain, ringing, and a spinning kind of dizziness. In documented cases, it has perforated the eardrum outright. The membrane standing between your hearing and that spike is about 1/10 of a millimeter thick. The same pressure also pushes mucus and whatever your nose was trying to expel up toward the middle ear, which is one of the recognized routes an ear infection takes. Painful, occasionally permanent, and still not what puts anyone in a hospital bed. For that, you need the second route. And in January 2018, a man in Leicester found it. He was 34, fit and healthy, and he held his sneezes on principle because he thought letting them out was unhygienic. One afternoon, a forceful one arrived. He pinched his nose, kept his mouth closed, and felt something pop in his neck. What gave way was his pharynx, the back wall of his throat. Air escaped sideways into the soft tissue of his neck, then tracked downward along the airway into the space between his lungs. Doctors call air in that space pneumomediastinum. Under the skin of his neck, it produced a crackling you can feel with a fingertip, like pressing bubble wrap through a jumper. He could barely swallow or speak, and his voice had changed. He spent around 2 weeks in hospital, fed through a tube, on intravenous antibiotics for 7 days while the tear closed by itself. The perforation was tiny. What kept him admitted was the risk of mouth bacteria being driven into his chest cavity, where an infection turned serious fast. The case ran in BMJ Case Reports in January 2018, under a title the authors clearly enjoyed writing: Snap, Crackle, and Pop. Their conclusion was blunt. Blocking both nostrils and the mouth to halt a sneeze is a dangerous maneuver and should be avoided. Then, in the same paper, they listed the other complications already attached to this in the literature. And one item on that list is worse than anything you have heard so far. Alongside the ruptured eardrums and the air in the chest, they noted that the same maneuver has been linked to the rupture of a cerebral aneurysm. An aneurysm is a weakened, ballooned section of an artery wall. Most people carrying one have no idea because it produces no symptoms at all, until the day it fails. A sudden, violent spike in pressure is exactly what a vessel like that cannot absorb. Keep the framing the authors used, though. It sits on a list of possible complications, and every patient involved already had a weak vessel waiting. Holding a sneeze does not build you an aneurysm. The list also carries cracked ribs, mostly in older patients with thinner bone, and air forced behind the eyeball, which swells the tissue around the orbit and closes the eye. For years, that list had a gap in it. The pharynx tore. The eardrum tore. The vessels tore. The trachea, the windpipe itself, was treated as too tough to fail this way. A thick tube of cartilage rings that could take anything a human could generate. That assumption held until a man got into his car in Scotland. He was in his 30s, had allergic rhinitis, and was driving when he felt a sneeze building. He pinched his nose, closed his mouth, and pain tore straight through his neck. Within seconds, his neck began to swell on both sides, and he could barely turn his head. Air was escaping from somewhere inside and filling the tissue under his skin. The same crackling as the Leicester patient, on a bigger scale. He was taken to Ninewells Hospital in Dundee. A neck x-ray found the trapped air. And the CT scan found what nobody was expecting. A tear 2 millimeters across in the wall of his trachea, sitting between the third and fourth vertebrae of his neck. The windpipe is a stack of cartilage rings joined at the back by a strip of soft membrane. The cartilage carries the load without trouble. The membrane is the weak point, and the tear ran along exactly that strip. He needed no surgery. 2 days of observation to confirm his oxygen levels held, then home, and a scan 5 weeks later showed the tear had sealed itself. The team published him in BMJ Case Reports in 2023, and their search of the literature turned up nothing comparable. He remains the only person on record to have torn his own windpipe by holding in a sneeze. So here is the obvious objection, and it deserves a straight answer. If the pressure is that dangerous, why is everyone fine? You have stifled sneezes, so have I. Billions of people pinch their nose every single day, in libraries, in meetings, in cars, beside a sleeping baby, and walk away with nothing worse than an odd feeling in their ears. Pressure needs somewhere to fail, and healthy tissue holds. The Dundee case is the first tracheal tear anywhere in the medical literature, and doctors have been writing up sneeze injuries for decades. That tells you how the odds sit on any single occasion. What shifts them is a weak spot you have no way of knowing about. A trachea thinned by a previous intubation. A connective tissue disorder such as Ehlers-Danlos. A throat inflamed by a recent infection. Age, and everything that changes in the tissue with it. Both men in these case reports were healthy and in their 30s, and neither had any reason to expect it. That is the uncomfortable part, and it is why the doctors bothered publishing at all. Now turn the whole thing around, because your body treats this as non-negotiable for a reason. The sneeze exists to solve a problem. Your nose has detected something it wants gone. Dust, pollen, a virus, smoke, and the reflex launches it clear at speed. Buruiba's team at MIT also measured how far clear. A sneeze throws a turbulent gas cloud that carries droplets as far as 25 feet and holds them in the air far longer than anyone had assumed. That number cuts both ways, and it is the honest tension in this whole topic. 25 feet is a solid reason to avoid spraying an open sneeze across a quiet room. It is a terrible reason to seal one inside your skull. There is a third option, and both case reports point straight at it. Keep the exit open and cover the outside. Sneeze into the crook of your elbow with your mouth open, or hold a tissue loosely against your face without sealing your nostrils shut. The cloud gets stopped, and the pressure still vents. If you want to head one off before it fires, firm pressure with a finger under the nose or on the upper lip interrupts the nerve signal in some people, which works on the reflex and leaves your airway out of it. The polite instinct was right. The method was the problem. Here's the whole thing in short. Your brainstem builds a pressure release before you get a vote on it. Pinching it shut multiplies that pressure past 20 times normal and sends it into your ears, your throat, or your chest. Almost always, nothing happens. Rarely, tissue gives way, and 2 men in Britain have the scans to prove it. So the next time you are in that third row, the vows are happening, the room is silent, and you feel the tickle start. You know what a stifled sneeze actually does. It cancels nothing. It only decides where the pressure goes. Let it out. Cover your face. And tell me down in the comments where your worst one happened, because I want to know how many of you are about to confess to the wedding. If you like the kind of ordinary thing that turns out to have a case report behind it, subscribe. There is a new one every week.